As we've learned, DSD for HIV treatment can be implemented through 4 models. These include group models managed by healthcare workers, group models managed by clients, individual models based at facilities, and individual models not based at facilities. But what happens when HIV treatment needs to be provided to specific populations? In some contexts, a new model needs to be designed. However, if any of the 4 models are already understood and implemented in a certain context, they can also be adapted to deliver HIV treatment for the specific population. Individual models based at facilities, like Fast Track, work for any specific population. So in this video, we will instead focus on some common adaptations of 2 of the other DSD models we have learnt about, club refills and individual models not based at facilities. Let's begin by exploring adaptations to club refills. Meet Noxie. Noxie started ART when she was pregnant. After giving birth, she decided to join a postpartum club for breastfeeding mothers. In the first few months after giving birth, Noxie visited the club more often so that she could get care for herself and her HIV-exposed infant. Noxie got a lot of support from the other mothers in the club, and she felt confident knowing she was giving her baby the necessary medication. Noxie's friend Samantha has a 14-month-old baby. Sadly, Samantha experienced HIV treatment interruptions after she gave birth, and her son has tested positive for HIV. Now she's joined a family club that's adapted specifically for parents and caregivers and their children living with HIV. The club's meetings are held in the maternal and child health units. Here, her baby can get ART and other child health services they need. Talking with other parents who are learning how to support their children living with HIV is also really helpful for Samantha. When Samantha's child grows up and becomes a teenager, he can join another adapted club refill model, a teen club. Teen clubs are often held on the weekend, so you won't have to miss school. When he visits the group, he will be able to meet and play games with other people his age, while learning about adherence and collecting his medication on time. Individual models not based at facilities can also be adapted for key populations. Meet Frank. Frank has been injecting drugs for several years and tested positive for HIV 2 years ago. Frank's local clinic has set up a community drop-in center near to his home. He can go there to collect his ART and receive harm reduction services. This means that Frank doesn't have to make 2 separate trips to 2 different healthcare facilities. The staff at the drop-in center also understand his situation, which makes him feel secure and supported.